Grew up in the inner city. I attended public schools. My junior high school was Harlem Park Junior High School, and I did fairly well, in the school system. And I had a counselor there who took a special interest in me, and she exposed me to this A Better Chance program, ABC, and that's sort of how I eventually got to Exeter. I always thought that I would like to be a teacher. It really wasn't until I went to Smith that I made the decision to pursue a medical career. When I finished my postgraduate medical education, it was time for me to pay back my service. So the computer matched me to Texas. Even though I was from Baltimore, I was like, Texas? I don't know anybody in Texas. I got here in 1986. It basically was a broken system. It was no healthcare system here. The Texas Department of Corrections was very dangerous during that time. A lot of gang activity, a lot of homicides, murders. So it wasn't a good time. It was a dark time in our history. And the state really needed my help. And I wanted to be part of seeing things to fruition, seeing things get done. And I realized within myself that the population that I would serve, even if I left Texas and went back to Baltimore, would be the same population of medically underserved, an indigent population. And so I said, my patients are already here and they need me. And so I stayed. We have between 50,000 offenders in 86, and we've tripled that number. The size of our system is enormous, and when you think you have responsibility for the healthcare delivery for 150,000+ offenders, that's the size of a pretty good city. And so the same issues that you see in a metropolitan, large metropolitan city area, you're going to have the same issues within our criminal justice system. We're part of public health. We have a very high-risk population. We have them, contained in the incarcerated setting, and we're able to do education with them. We're able to do some prevention with them, and we're able to treat them. In my mind, there's no difference between treating an offender and treating a patient in the community. They're all patients. And as healthcare professionals, based on our professional ethics, that's how it has to be. They're our patients. And so the same obligations I would have to you if I saw you in a community or free world setting is the same obligation I have to the offenders. If they don't have the support while they're in here, when they get out, they won't have the support. And the goal is to keep them out. To try to do all that we can to make their re-entry into society, one that'll be good so that they can live a crime-free life. I have sacrificed, in terms of my personal life, a lot for what I felt was a call on my life here to do. The Lord Jesus said, "You did this to the least of these, my brethren, you've done it unto me." Now, even if you're not, particularly religious or whatever, you look at them and you say, this is somebody's mother, this is somebody's father, this is somebody's wife, husband, children. And but for the grace of God, there go I. I truly believe that if I never went to Exeter, I wouldn't be here today. I would not. I don't even think I would be a physician if I hadn't went to Exeter. Because Exeter taught me that there was better and more in life than I had been exposed to. And Exeter gave me the confidence in myself as a woman, and also as a minority, to say, hey, you can succeed. You can be whatever you want to be. And so I always credit my success in life to the education I received in Exeter.